So taking that outcome and running with it as like no cardiovascular risk, like, I think that's a bit haphazard personally. Yeah.
Okay, so let's talk about some of the important risks that, people should keep in mind when they're going to start testosterone replacement therapy. I know you've talked about this, heard about it, like the cardiovascular disease risk. I mean, for a while it was a controversy, right? Like doing testosterone replacement therapy is going to increase your cardiovascular disease risk. There's the Traverse trial that's kind of, we got some pre data here, where it seems as though this is a very large trial, placebo-controlled, where it seems as though these are older men that were, at least it seems to be hypogonadal, like they were low testosterone. And if they were given testosterone replacement therapy to a normal, like physiological restoration range, there's no really adverse effects on cardiovascular outcomes.
So taking that outcome and running with it as like no cardiovascular risk, like, I think that's a bit haphazard personally. It's just like don't take that as like the sign off that like you're, 200 milligrams of testosterone and enanthate per week, that you're like, more aggressive protocol has been designed to do is like going to be the same outcome. Like, it's not. You're going to have a lot of things that you're looking to get the reassurance that won't happen, but you absolutely need to be cognizant of, because it will probably happen still.
It is important because you mentioned your erythropoiesis, and so this is another kind of concern, with testosterone, which does regulate red blood cell production. It does increase, the thickness of blood, and polycythemia is a I would say a risk factor, right? So, how substantial is this? I mean, I think I've read studies where it's like almost 25% of men have thicker blood that are on testosterone replacement therapy. So for people like listening or watching, that isn't a concern because it increases, stroke risk. It increases the potential for, cardiovascular events as well. So like, what are your thoughts on sort of weighing those risks?
So I think it's more about, there is a risk, but there's not going to be data that says directly, if you replace to 800 total T, it's going to be dangerous, nor is there data that says it's safe either. You have to weigh the risk accordingly, because it's not risk-free. Like, you're still going to have to keep an eye on your hematology panel. So yeah, it's just like an understanding of all of the interplay of things, and not taking the sign off, the Traverse trial is like, you're get out of jail free card. Like, it's just, you're still gonna have to keep an eye on your blood work.